According to Natalie Martinez on KTXS News reported, drug-related CPS cases clog up Taylor County Family Court and backlog comes from an increase in emergency removal. In 2015, there was 255 reported. In 2016, there was 259 reported. And as of June 30th this year, 155 reported. Child neglect because of drug abuse occurs at all levels: social, economic level, ethnic, religion, and education. We might not know that there's many forms of child maltreatment: neglect, physical abuse, sexual abuse, exploitation, and emotional abuse. Many of us have family members that have children, and we do not want to see them harmed or taken by CPS. I have done extensive research on drug-related CPS cases and found shocking statistics and facts on this issue. In addition, I was once a drug abuser, and my family did interfere and took my children, and CPS did not have to get involved. Because of drug-related CPS cases are a serious problem in the Taylor County, the community should have information of drug abuse and what resources are available. I advise that we inspire people to learn signs and to offer help to their family members. Let's start by looking at the problem. The first part of the problem is the staff shortages in CPS investigators. The Associated Press reports staff shortages in CPS investigative branches have been problems in both regions since fall. Officials said even after help from other regions, Travis County still has 1,000 cases that have gone at least 6 months without being investigated, and 500 of those cases are in Midland, Odessa area. Roberts, Zan, Severin, Armstrong said, current data indicate a pattern of significant racial ethnic disparities in reports of newborns to Child Protective Services related to maternal drug use during pregnancy. Though it is obvious that drug-related CPS cases is a major problem at a national and local level, it is clear that many people are uninformed on how to help a family member. The second part of the problem is that people do not know enough about the signs of drug abuse and what resources are available in their community. The Daily Connection reports, if you're a teen who's suffering from drug abuse, there are solutions and you can get help. For help with a drug problem, go to www.findtreatment.samhsa.gov to access information about a treatment center near you, or call the national hotline at 1-800-662-HELP. Zoll, Bartleson, Bailey, Lostein, and Dart, using the Research, Abuse, Diversion, and Addiction-Related Surveillance System, stated education efforts could be directed to parents to recognize warning signs of prescription drug abuse or misuse in the home. It is our hope that this will aid in designing focused intervention and educational programs to prevent further prescription drug abuse in this population, which may include school-based screening, legal implications, and drug enforcement administration. It is clear that drug-related CPS cases is a substantial problem that needs to be spoken. A solution is dreadfully needed. A solution I propose is to prevent backlog in drug-related CPS cases by helping people identify the signs of drug abuse and child neglect. This solution will work because there is resources available on the internet, website, and prevention resources. For example, 211. Child Help website talks about what child abuse is. It also tells you the different types of child abuse and their signs. They also have prevention, intervention, and treatment programs. Over 10 million children have already been impacted by Child Help, and in Texas, 70,710 children impacted. 211 Services is an easy-to-remember phone number assigned by the Federal Communication Commission and to streamline access to health and human services. It provides individuals and families in need with a shortcut through what can be a maze of Health and Human Resources Agency phone numbers. Those in need of assistance can be referred and sometimes connected to appropriate agencies and community organizations. Information and referral refer to the system of connecting victims of crime and others impacted by violence or crime to appropriate resources. In 2017, 211s across the United States answered over 13.4 million calls and almost 1 million in text messaging, web chats, and emails. In conclusion, it is true that backlog in drug-related CPS cases remain a problem, and people are uninformed of the signs and the resources. I ask that you consider my proposed solution of encouraging others to educate themselves in child abuse signs and resources available in their community. In doing this, many people will be aware of what they can do to help others. This is a crisis with urgent needs, and we need an urgent solution. It will take everyone to solve the increase of drug-related CPS cases problem, not just law enforcement and social workers.